Good day, everyone. These are the basic knowledge every contact tracer should know. The coronavirus came from a large family of viruses. It may cause illness in humans and animals. Species barrier is a natural mechanism that prevent a virus or disease from spreading from one species to another. The severe acute respiratory syndrome or SARS was the first pandemic from the family of coronavirus. The disease came from Guangdong, China in around 2002 and 2003 and contained globally after 8 months. Another disease from the coronavirus family was the Middle East Respiratory Syndrome or MERS. This disease was a public health emergency of international concern only and didn't declare it as global pandemic. Unfortunately, last December 2019, another disease was developed and declared as a global pandemic. COVID-19 was a third disease coming from the coronavirus family. The mentioned severe diseases share the same signs and symptoms, which is all related to respiratory. What is COVID-19? It is a contagious or infectious disease that's already spread globally. Before the outbreak in Wuhan City, China, last December 2019, this disease doesn't have any existing case in the world. It was recently discovered, that is why it is called novel coronavirus. Furthermore, the causative agent is a severe acute respiratory symptom coronavirus 2. The incubation period would be the time of the exposure to a COVID-19 patient, be it suspected, probable, or laboratory confirmed. The shortest incubation period is within 2 days up to 14 days, and the average incubation period is 5 to 6 days after the exposure to a COVID-19 patient. During the first 3 days after the onset of symptoms is the most infectious period. What are the symptoms of COVID-19? The common symptoms are fever, tiredness, and dry cough. A dry cough is a cough that doesn't bring up mucus. Other symptoms include joint and muscle pain, nasal congestion, and runny nose. A runny nose is excess nasal drainage. It may be a thin clear fluid, thick mucus, or something in between. In addition, sore throat and diarrhea are common symptoms of this disease. These symptoms are usually mild and begin gradually. For the disease spectrum, when we say symptomatic, it exhibits or shows signs and symptoms, while asymptomatic means exhibiting or showing no symptoms. Approximately 80% recover from the disease without needing any special treatment. However, 1 out of 6 people affected with COVID-19 may become seriously ill and may develop signs and symptoms of difficulty of breathing. Elderly people aging 60 years old and above are more likely to develop serious illness. But it doesn't mean that if you are in that age range, you will acquire or develop this virus. In addition, people with underlying medical conditions such as high blood pressure or hypertension, heart problem, diabetes, obesity, or other related condition in heart, lungs, or kidney are more likely to develop this disease. How does COVID-19 spread? People can catch COVID-19 from others who have the virus. You can get the virus without someone passing it on to you. Transmission can be from person to another person through droplets. Droplets can travel for about 1 meter distance. When we breathe in the droplets from a person with COVID-19 who coughs out, we can easily be infected. According to World Health Organization, small droplets can still stay in the air for about 20 minutes before it falls down, while the larger droplets tend to fall down easily. We can easily be infected if we touch objects or surfaces where droplets from infected people landed then touch our eyes, nose, or mouth. Coronaviruses can survive on surfaces for a few hours up to several days depending on varied conditions. Knowing how to prevent is very important if there is a fomite transmission. Thus, we need to be meticulous every time we touch things and having a contact with other people. What are the preventive measures? If we touch things with or without contamination, we need to practice hand hygiene. Hand hygiene includes washing our hands frequently with soap and water, 70% rubbing alcohol, alcohol-based hand rub, However, alcohol-based hand rub is not that recommended because of the moisturizer and perfume that decreases its alcohol content. In addition, we should always maintain and practice social distancing. Lastly, avoid touching our eyes, nose, and mouth. These are difficult to do, but we should make it as a habit to prevent acquiring and developing the virus. For respiratory hygiene, cover your mouth and nose when you sneeze. If you don't have anything to cover your mouth, bend your elbow, then sneeze, but don't forget to wash it or apply alcohol after. Nowadays, tissues are more preferred than handkerchief because it is disposable. Used tissues should be disposed properly since it is considered as biohazard material. We need to provide a trash bin for biohazard materials to avoid contamination and the spread of virus. Furthermore, we should seek early medical care if we have fever, cough, or difficulty in breathing. If you are feeling unwell, stay at home and don't force yourself to go outside. If you have the symptoms and if there is a local transmission within your area, seek for medical attention and follow the directions of your local health authority.